I'm lucky enough to have my own fully accredited operating room on the premises of my office. Why is this so good? Because I have total control over everything that goes on there. When I go to the hospital, there can be a new nurse, a weak nurse, an anesthesiologist that isn't great. The nurses are frequently taking breaks. But when I do something in my office, I've hired only the best anesthesiologists, only the very best nurses. And not only are they great, but we work together all the time. I've been operating Tuesday, Wednesday, Thursday for as many years as I can remember, and I have the same scrub nurse in the operating room. Every case I've done, except for once when her husband needed to have a procedure done and she had to attend to him, I had her at every one of my cases. I use the same anesthesiologist and I use the same nurses in recovery room and in the operating room. We work very effectively together as a team, which brings an enhanced level of safety, comfort, efficiency, and privacy to each patient. In addition, by doing the procedures in my operating room, I have total control of the medicines that the patients are given. When you go to a hospital or a surgery center, there's a businessman, a non-doctor, in every situation who's checking on the anesthesiologist to make sure they're not spending too much on drugs or using instruments that are too costly. I have never had a discussion with my anesthesiologist or my nursing staff about the cost of our goods or the cost of the medications that the anesthesiologist is using. The only directive I've given them is make this the best. So the suture material I use costs substantially more than what you see at most, but not all hospitals now. The anesthesiologist has no restriction on the medicines they give, so our patients go to sleep comfortably, wake up quickly, and nausea is an extremely rare phenomenon. So, from the point of view of your safety and your comfort, I can think of no better way than to have it done in a private accredited operating room such as mine, in which the doctor has given specific instructions to run everything as well as possible.